Hi, my name is Dr. Mohammed Aalai, and I'm here with Pain Free Lives. And I wanted to talk to you guys today about some small concepts related to PRP, otherwise called platelet-rich plasma, or treatments, whatever you want to call them. PRP has gained a lot of traction over the past few years, especially it being advertised for many different uses, cosmetic uses, regenerative medicine uses, etc. It has a lot of different indications. It can be used for different things. What it really is basically your blood that we take and we draw it up, we'll centrifugate it, we put it into a centrifuge and spin it to isolate the platelets and the proteins and some healing factors that are in that yellow fluid that we get basically from your blood. When we take that, once we isolate it, we end up putting it inside your body for a variety of different uses. People use it for cosmetics, like I said, or they can use it for injections in soft tissue, joints, the spine, knees, elbows, shoulders, neck, anywhere. People use it for a lot of different things. Effectively, there's some good evidence for certain things that PRP does very well. It's been proven to be very effective for tennis elbow. So if you have lateral epicondylitis, otherwise known as tennis elbow, that is basically something that's been proven in multiple studies to be very effective for. It's still not covered by insurance, despite the fact that there is data that shows that it does work for this specific injection or indication, for instance. That is something that may take some time, but it has been proven for that. It's also been very, very effective for a lot of other things, but in terms of evidence-based, that's the thing that has the most strongest evidence for it in terms of what's been researched for tennis elbow. That's just in terms of the facts of what people have been able to research regarding it. In general, one very important concept with PRP is that we have to understand that people will tell you that it will heal you. I think this isn't not exactly the correct terminology. So saying that it heals may not be exactly an accurate depiction of what it does. I think the most important thing is that you understand that when we're getting all these platelets and the proteins and all these quote unquote growth factors and we're putting them somewhere inside, for instance, your knee, our goal is to basically improve the function and minimize pain. However that works, where there's some kind of inflammatory process that we induce in that area where it may cause swelling, redness, etc., that will actually bring stuff to help improve function and pain. Stating that it will heal, whether you're looking at x-rays or MRIs to see did anything change, that's not really the goal. It does happen. Sometimes we do it inside a disc in the spine, for instance, and the disc used to be flat, and then you see on an MRI like a year later that it has actually regained its disc height, which is good because the discs are shock absorbers for the spine. But again, this is not something that we can prove that it is definitely something that occurs, and it's not really, our endpoint is not radiologic or histologic, looking at tissue or imaging. We're looking at how the patient does in terms of, are they doing better? Do they have less pain? Can they run more? Whatever their life needs them to do, are they able to function? This is really the main goal of PRP, is to get the patient to be better overall and function better. That's very important. Again, I think the uses that we discuss, it can be used for joints, soft tissue healing. It can be used for cosmetics. Sometimes people do microneedling and they'll put it on their skin. So this is definitely something that we can do for patients as well. Cosmetics is definitely a big indication for PRP, and it does rejuvenate the skin, the surface of the skin. It's been proven for that. There's some things that it's not very good for. People have been using it, for instance, for fillers effect and stuff like that. It doesn't really do that, but it will actually rejuvenate and retone skin, and so it does help with that. One other thing that should be discussed in terms of when should I get PRP, should I do stem cells? A lot of patients ask me about stem cells versus PRP. I think the most important thing is that if you're a younger patient, PRP is probably good enough for you. Stem cells is rarely indicated, especially not as a first line. If you're an older patient, over 65, generally stem cells, your own stem cells, are not going to be very good for you, so we might have to harvest them from some other place. But PRP is still something you can try. I would say that even with older patients, PRP does seem to provide them with significant relief in terms of improvement in pain and function. I've done this for my entire family, my mother and my grandmother, to their spine, to their shoulders, multiple joints, and it's been very effective for them, and they definitely do get it done. I think another thing is the type of PRP you're using. We use a very high-end kit here that costs around $200+. That will affect the cost of the procedure. Some people might give you a lower end price saying it's $200 or $300, but they're not using a kit. So if anyone's giving you any prices that are really low, they may not be using the proper isolation kits, which is not going to give you the best outcomes. I think that's very important to know. We do not charge a lot of money in my practice for this. We're probably one of the lowest in the area, and we use a very high-end kit that costs us a lot of money, if not the most expensive one. Very important to trust who you're going to, just to know that they're giving you the best possible chance to do well and the most value for your money, which is important when you're not using your insurance for something like this, which is out of pocket. All right, guys. Again, just a brief overview of PRP and some of the regenerative medicine stuff we do, and some of the indications and some of the things to look out for. If you got any other questions, guys, you can put in the comments. I'll try to get back to all you guys and answer anything that I can. Otherwise, please continue to like, follow, and subscribe, and we'll talk to you soon. Take it easy.